Member for Gippsland East.
Thank you, Speaker. My question is again to the Minister for Health. Last August, Stephen of Traralgon phoned 000 at the direction of his GP because he was experiencing excruciating abdominal pain. 000 dispatched paramedics. However, while halfway through the call, they were told to leave him for another call. In significant distress, Stephen's wife drove him to the hospital where he spent several days. Why are seriously ill Victorians like Stephen being told to drive themselves to hospital if the system is up to standard, as this government claims it is?
The Minister for Health.
Can I thank the member for Gippsland East for his question? I think the honourable member said that that was in August of last year, if my memory serves me correct. Thank you. I'm more than happy to follow up the particular circumstances of that Traralgon case, should the honourable member be in a position to provide them for me. But in regards to the general proposition that the honourable member raises, what we do know is that during the course of a global pandemic in which our ambulance services and indeed the emergency services part of ESTA have been under pressure like never before in their recorded history, indeed to the point where in the last quarter of 2021, the year the honourable member's question relates to, that ambulance service saw a record level of demand in its services when it comes to Code 1 sirens and lights call-outs, to the point where at the same time that same service was delivering, through infection prevention and control measures, supports for its staff that necessarily placed both the staff and their patients at particular risks that were having to be managed as a result of the COVID-19 pandemic. Then indeed again, we've also seen during that period of time, over the course of the pandemic, significant impacts on the workforce itself. In terms of August 2021, that wouldn't have been to the same extent as it is with the Omicron variant. So in terms of this, and we've seen since then, not just record investment in the 2021 year of over 700 extra paramedics being delivered into that system in that course of that financial year. We've also seen how these services relate across the demand period of how the call allocation dispatch system from ESTA is managed in that relative priority sense. So it's a bit hard to give the honourable member a specific answer to his...
Minister resume his seat for a moment on a point of order. Member for Gippsland East.
Thank you, Speaker. I appreciate the minister's answer, Speaker. And without repeating the question, the premise of the question was, how can the government claim that the system is up to standard if people are having to drive themselves to hospital? And I would encourage you to bring him back to answering that element of the question.
Order. The substance of the question was a broad one. Why are seriously ill Victorians being treated in such a way? And the minister's being relevant to that question.
Thank you, Speaker. So in regards to the particular circumstances in Traralgon in August 2021 and the relative decisions as to what were the clinical priorities for available assets in a global pandemic at that time, I would have to take that element on notice. But in regards to the general proposition, what our paramedics know, what our emergency services know, what our emergency departments know is that this is a government that can be trusted to deliver on the investment and the support that they need and Victorians need to recover from this global pandemic and continue to deliver world-class service.